You've probably been told exercise is great for low back pain, but what if I told you not all exercise is great for all types of low back pain? And what if I told you some exercise can be downright harmful for low back pain? So I'm Jason Patterson, I'm from Coffs Total Chiropractic, and today we've got a little bit of a longer video for you on the benefits and pitfalls of exercise and low back pain. First step is understanding what type of low back pain you have so you can apply the right type of exercise. For the purposes of this video, we're going to concentrate on two main types, one being acute problem, the other is a chronic. So acute pain is often has characteristics of sharp, stabbing, grabbing, pinching, usually a more recent injury. There's usually swelling, inflammation involved. Acute pain is a sign that there is tissue damage and it needs time to heal. Exercise during this phase can be unhelpful and at worst can be harmful. Chronic pain is longer term, often greater than 3 months, which is considered to be longer than the time required to heal the initial injury. It's often described as deep, dull, achy, widespread type of pain. There is often a loss of mobility associated with this type of problem. So what the research says about acute pain is that exercise doesn't help, which makes sense because there's tissue damage, needs time to heal. So further exercise at this stage can weaken and re-aggravate the inflamed spots. Research also says bed rest will get worse results. General advice is to keep performing usual activities within your pain limits. I would also add, try and do as much walking as you can tolerate, as the walking will actually pump swelling out of the damaged areas and help with healing in that acute phase as well. In some severe cases, this means walking up and down the hallway and having a lie down a few times a day. In other cases, it just means getting off the office chair as often as possible and having a walk around. In this acute phase of the injury, ice packs often help. I will be doing a more detailed video soon on heat versus ice, what to use when and how to use it. So when the injury has passed from the acute phase into a more chronic phase, exercise has been shown to be more helpful. Two major categories for exercise in this phase of an injury recovery. The first is whole body movement. That's where you are using your spine, arms and legs all together. Walking, running, swimming are the most helpful here. They improve blood flow, overall fitness and brain-body coordination. When brain and body talk to each other properly, you're much less likely to get re-aggravation because you are protected when you are moving better. Regional spinal movement. This is where the spine is moved through a full range of motion. Walking, running, swimming move you through the middle parts. Things like your spinal rehab exercises, yoga and Pilates, get each section of the spine to move through its full range. The regional spinal movement is what most people imagine when they think of back exercises. What not to do is a loaded question. There are many exercises that are harmful to one sort of problem that benefit a different problem. It's always best to have a trained professional assess what your body can tolerate and what's going to help your body heal. So there are exercises that are commonly recommended for many low back problems that actually feel good, that it can actually feel good, but are harmful. A prime example here is the child pose, which is very common in many yoga classes. Many patients I see report they feel better after they do that, but complain that their low back is aggravated when they bend over. So what happens here is the child pose will stretch the low back muscles, which does help you feel good in the short term. But what happens on the inside around the vertebra and the disc is that the weak connective tissue is being pulled apart, constantly being aggravated, and makes it harder to heal. A bit like picking the scab, doesn't heal as quickly or as thoroughly as it should. Once we eliminate those movements that cause damage, the spine can heal and you can truly get longer lasting results. So what else can we do? There's another piece of the puzzle that is often missing, and it's called spinal segment movement. It's often the most neglected, and this is where individual vertebrae get stuck. They jam together, cause friction and pressure, which is a big cause of lower back pain and pain in the spine in general. Things like too much sitting, bending, lifting, emotional overload all cause segments of the spine to stiffen. Because of the way the brain controls the spine, it's impossible for us to move individual segments of the spine by ourselves. This is where chiropractic adjustment comes in to restore movement and balance and reduce friction and stress. You know you will need extra help like a chiropractic adjustment if you can't do the exercise aggravates your problem, or you've been doing them for 3 weeks and you're not getting any improvement. Sometimes you just can't exercise your way out of a low bad back. If you've tried the usual back exercise, yoga, Pilates, and you're still struggling with back pain, maybe it means you need a chiropractic adjustment. There's no need to struggle with a bad low back. We've helped thousands of people with low back problems over the years here at Crofts Total Chiropractic. So my recommendation is give Kathy and Shannon a call on 66524025. Make an appointment today and we'll get to the root of the problem.